Good morning, and welcome to The Road to Transformation, a Community of Care. Whether you are joining us live this morning or watching the videos in the future, we are thrilled that you are here to learn about complex care in our community. I'm Peggy Schaefer, Project Manager with Region 4 Area Agency on Aging, and it is my pleasure to work with the local and national speakers that you will hear today. For more than a year, we have researched trends in healthcare, analyzed local statistics, and interviewed those with lived experiences in complex care. And now we come to you, Michigan's Great Southwest, with one goal in mind: to bring you to the intersection where care in the community meets medical care to create a community of care. And now let's hear from Dr. Lauren Hamill and Lynn Kellogg.
So you might be wondering, so what exactly is complex care? Well, complex care addresses the needs of a person whose medical, behavioral, or social needs results in high utilization of healthcare and high costs. Until recently, efforts to improve the health of older adults focused mostly on expanding access to quality medical care. But we must also consider the social conditions in which a person lives as critical to improving primary prevention and the treatment of acute and chronic illnesses. Decades of research show that social conditions, such as having access to stable income and housing, nutritious food, appropriate health care, reliable transportation, and social support are all a critical part of health. Improving these conditions can lead to better health and reduce inequitable health care outcomes. We also know that COVID-19 has changed how people use health care and community services. Many older adults have delayed important medical appointments and restricted access of others into their homes, so the use of telehealth technology is critically important. We also know that human-centered design and user-friendly digital tools can broaden the scope of clinical visits without increasing the length of them. All of this is an important part of a complex care strategy. As we work with community-based organizations like Area Agency on Aging to build a system where older adults with complex care needs are connected to medical and community-based services, it's our hope that other organizations, medical providers, and the community will join us. By working together, we can help our friends and neighbors on the path to aging well.
Hi, I'm Lynn Kellogg, Chief Executive Officer at the Region 4 Area Agency on Aging, and I'm so happy to join Dr. Hamill's welcome to this exciting discussion and collaboration. The Area Agency on Aging lives under a corporate mandate to create comprehensive, coordinated systems of care so elders in society and vulnerable adults of any age can live independently in their homes or places of residence for as long as possible. Our mission is simple: to offer choices for independent lives with the vision that every aging adult leads a quality life. For years, and ongoing, this has involved building a range of community supports and services dealing with nutrition, transportation, legal support, housing, a plethora of services going into the home, establishing day centers, educational opportunities, intergenerational efforts, encouraging business development around a host of products and services helpful in everyday life, and being a trusted source of information and options when life becomes challenging and we need to brainstorm some solutions. One of the things we do is operate a health plan called My Choice for persons aged 18 and over living at home with daily needs equivalent to care provided in a nursing home. To say their stories are inspiring is an understatement. They overcome tremendous limitations to common activities most of us take for granted, often managing multiple chronic conditions at the same time. I've come to believe where there's a will, there's a way. We are a loving, interdependent society. Our interdependence through life with friends, family, colleagues, neighborhoods, communities, and on up is our personal key to resilience and ability to thrive. It only makes sense that we take that value of interdependence into healthcare. The partnerships Area Agency on Aging has formed with medical partners like Spectrum Health Lakeland create rich opportunity to broaden the perspective of interdependence to create a community of care. We're so glad you joined today and are convening with us on this journey. Welcome.
We want to give a big thanks to the Michigan Health Endowment Fund for enabling us to get to this exciting juncture, the end of a planning grant and the beginning of an implementation grant, moving towards what we're calling a community of care. A pinch of history will provide some framework for today's convening. A broad-based group consortium of local health CEOs formed years ago as a platform for creating a meeting of the minds, so to speak, on data-driven trends in healthcare. Healthy Berrien Consortium has been the launch pad for multiple successful initiatives through the years. Interest surfaced some years back in finding a way to help the older population and vulnerable adults in general manage chronic illness and transition well from hospital to home. This led to a multi-year effort called the Interagency Care Team, or ICT. Consortium reps mapped out the array of community services available for follow-up support after discharge and discovered many weren't well understood at all and became intrigued with the art of the possible. Key medical and community-based clinicians met bi-weekly for nearly 2 years, sharing knowledge, aha moments, changing procedures, patient education materials, and crafting a partnership targeted to help persons with astounding rates of emergency department ED usage. A plan was hatched. The Michigan Health Endowment Fund and several local foundations got on board. A private evaluator was hired, and work began to learn about barriers to healthcare from the patient-person perspective, test the efficacy of interventions against key metrics, and explore payment models for sustainability. The results? 48% of patients seen identified an eye-popping 10 or more personal barriers to their health. 14% identified 20 or more barriers. By creating an interagency care team, 91% of all barriers were resolved. ED usage went down, primary care visits went up, and after the first 6 months of enrollment, the average cost for patients served decreased 55%. Partners from the multiple agencies have been working ever since to test payment models and create structural linkages for sustainable partnership. Meanwhile, the success found in interdependence between organizations, bringing together core competencies towards a common outcome, cemented the value of interdependence, encouraged collective impact, and made us all want to push further. We're now building off the lessons of the ICT and taking them to a broader platform. A steering committee was established by leaders from Region 4 Area Agency on Aging, Spectrum Health Lakeland, and Caring Circle to establish a shared vision. The idea of a transformation strategy was created in pursuit of a community of care for older adults and their caregivers. The steering committee took, and still takes, joint ownership of the effort and commitment to the project. We've come to know each other very well. Tasks included understanding the broader population of the area, identification of common barriers, and creating strategies to overcome a disjointed system. A planning grant from the Michigan Health Endowment Fund was secured with 4 priorities in mind: proactively creating an integrated and sustainable system of care primarily for older persons with complex needs and well as their caregivers, improving access to current services, reducing barriers, and expanding needed community services. This morning, you'll hear from analysts working with the project and 2 outstanding nationally known speakers, one from the medical field, one a home and community-based advocate championing the value of interdependent systems. We hope to inspire you to action and maybe join our efforts. Here to start us off, it's my pleasure to introduce Altarum, a nonprofit healthcare research and consulting organization headquartered in Ann Arbor. Their mission is to conduct research and implementation work that supports health equity, quality, and access for vulnerable populations, particularly those reliant on Medicare and Medicaid. The Altarum Center for Elder Care Improvement specifically focuses on the older population and their particular healthcare needs. So, To start us off, I'd like to welcome and introduce Dr. Beth Bowden-Seiler and Ms. Morgan Perry to share results of a data deep dive Altarum did for our community care work.